Good evening, everyone. I'd like to extend a very warm welcome to our panelists and to all attendees tonight who have taken the time to come to this IIOP special edition webinar on the introduction to the Common Conditions Service. My name is Dawn Davin, and I'm here in the role as IIOP facilitator for the webinar this evening. You may notice that our usual Zoom interface looks a little bit different. It's because due to the large number of registrants, which is fantastic, we've had to change to the webinar platform. So as usual, cameras and mics have been disabled, but on this occasion, the chat box is also disabled. But I'd like to reassure you that the Q&A function is available, and we'd encourage all attendees to post their questions in the Q&A box. Sincere thanks to all of you who have already submitted questions. We've received a large number of fantastic questions, and these have contributed to the content of tonight's webinar. In addition, I'd just like to reassure people that your questions that have already been submitted and those from tonight will be forwarded to the Implementation Oversight Group to inform a guidance document for the next phase, which I know our panel are going to talk to shortly as well. So just to give you a little bit of context on this webinar this evening before I just work through the domestics, the intention of tonight's webinar is to provide you with the context and background to the Common Conditions Service itself, to discuss the development of the clinical protocols that you as pharmacists will use in the delivery of the Common Conditions Service, to look at the legislative changes and the regulatory requirements for the service, and also to walk you through the training requirements for the service. We're very mindful that the webinar will likely not address all your questions. And again, we'd just like to offer assurances in that regard that the IIOP are in the process of planning further webinars to cover aspects such as the implementation of the service in practice and to cover some of the clinical topics themselves. So in terms of domestics, this webinar will be recorded. And if you have any difficulty with the sound, just if you'd like to turn on and off your computer or your device to see if that helps, that can help sometimes, and try logging off and logging on again, the old golden favorite. Please, as I say, you take the opportunity to use the Q&A box for any questions you may have, and we may use some anonymized information from the webinar. So without further ado, I'd like to introduce you to our panel for tonight. Thank you. So our first panelist this evening is Kane, Head of Medicines, Controlled Drugs and Pharmacy Legislation in the Department of Health. Dr. David Hanlon, GP and National Clinical Advisor in Primary Care in the HSE. Dan Burns, Head of Registration and Education in the PSI, the Pharmaceutical Society of Ireland. And Ailbhe, CPD Quality Assurance Pharmacist in the Irish Institute of Pharmacy. So I'd like to offer you our extended warm welcome tonight as well, and thank you very much for taking time to be here. And without further ado, I'll hand over to you, Catherine, please. Thank you.
Thanks, Dawn, and hello to everybody. It's a pleasure to be here, and I'm just going to take you down through the slides. Next slide, please. So the outline of today then really is just to give you a bit of a background as to where we've been to get to here, so the journey so far. I want to talk to you a little bit about the expert task force and the implementation oversight group, which has been really fundamental to get this service over the line. A little bit about the engagement with key stakeholders, legislative reform, media campaign, and then really what comes next. From my own point of view, so my title, Catherine Kane, Medicines, Controlled Drugs, Pharmacy Legislation Unit, is a bit of a mouthful, but essentially one real important area of our unit is the responsibility for the development and implementation of pharmacy policy. So I'm joined, I know on the call here with a couple of my colleagues, so thank you very much to them for the work that's gone so far. Next slide, please. So in terms of the journey, if we look at the evolution of the task force, the implementation oversight group, and then towards the current day, in 2023, the expert task force was set up to support the expansion of the role of pharmacy in July of 2023. It had 13 members, so representing stakeholders across the sector, such as the 3 schools of pharmacy, the PSI, the medicines regulator, the HPRA, practice practicing pharmacists, doctors, the HSE and the Department of Health. They had an interim report that was published in November 2023, which had 13 recommendations that really focused specifically on prescription extension. Moving forward then into 2024, they continued to work together where it completed its final report. 22 recommendations were brought forward for ministerial approval under 8 headings, which focused primarily on pharmacist prescribing. So really, if we think about that, the primary recommendation was that pharmacists should be enabled to exercise independent, autonomous prescriptive authority within the individual practitioner's scope of practice and competence, and that should be implemented in a stepwise manner, commencing with the introduction of a common condition service, which has brought us to where we're here today. So in 2025, an implementation oversight group was set up to allow for the development of all key enablers to facilitate the establishment of the common condition service. We've met on a monthly basis in addition to having regular small subgroup meetings, and I'll talk a little bit more about the work streams shortly. I suppose the key outputs really then, we have the 8 protocols that have been developed, and my colleague Dr. Hanlon will speak to that after me. We've had 3 regulations to be put in place to enable and to underpin the service. The PSI have put education and training rules in place and prepared guidelines for pharmacists, and then together we've developed a communications plan. Next slide, please. So I suppose looking at the work of the task force in a little bit more detail, it's very much a phased approach. So 3 distinct phases stemming from the report and the recommendations. Phase 1 was around prescription extension. So obviously during COVID, the validity period was extended to 9 months to create some capacity in the health service. And this was really a success, and there was calls for this to be extended following the end of the pandemic. So the task force considered the evidence and decided to extend this further. Prescriptions, as we know, are now valid for a maximum of 12 months, with pharmacists enabled to extend certain 6-month prescriptions. And so then moving forward into phase 2, this was a real key next step in the reform of pharmacy, to move forward for the introduction of the Common Condition Service. And this service will be the first step in enabling full independent pharmacy prescribing, allowing pharmacists in Ireland to treat the public for 8 common conditions such as shingles, UTIs and conjunctivitis. And I know Dr. David will speak to that a little bit more later on. And then moving forward, I suppose phase 3 is really empowering independent pharmacy prescribing, extending models of independent pharmacy prescribing across primary and community care, primary and secondary care. And looking forward, I suppose, to the future, which is fantastic. Next slide, please. In terms of the final report, so I've said that it was published in August 2024. It was split into 8 distinct chapters, which included overarching recommendations, calling for real patient and public involvement, leadership and governance, research and review, communication engagement, education training, and so on. Next slide, please. So the implementation oversight group that was set up in 2025 had 6 distinct work streams. So if we look at them there from stepwise across left to right, work stream 1 was the development of protocols for the Common Condition Service. Work stream 2 was education and training for pharmacists and regulatory matters. Work stream 3 was around the delivery of the service and operational aspects. Workstream 4 was around the legislation that was required to enable the service. Workstream 5 was implementation of enablers for a contraceptive prescribing, which I'll speak to later on. And Workstream 6 was a communication plan for the public and healthcare professionals. There were 3 subgroups working across all of the work streams. So we had a HSE clinical subgroup, which was supporting work streams 1 and 5. We had a patient and public involvement subgroup, which was supporting all of the work streams, and then we had a communications subgroup as well. So the implementation oversight group was chaired by the Department of Health. It had a wide-ranging membership, which included the HSE, PSI, HPRA, IPU, pharmacist, and patient representatives. Excuse me. There were very much structured outputs from the IOG. So there was terms of reference, we had meeting minutes, protocols, development, legislative, operational aspects, communications plan, and support materials for pharmacists, including a consultation form and a prescription template. So we continued to meet on an ongoing basis. Next slide, please. And this slide really is just to speak to the key elements of engagement with stakeholders and how instrumental the relationship building between everybody was. So the membership of the IOG and beyond was really, really critical. I just want to give you some examples, I suppose, of how the stakeholders working together added value. So, for example, the public and the patient interest group and wider public and pharmacists came together, and the engagement with the public consultation really helped to inform both the task force recommendations and their implementation, where they showed really strong support for the implementation of a common condition service. 83% agreed or strongly agreed it was a good idea and supported the concept of the common condition service. Personally, having a practicing pharmacist and a pharmacist involved in service delivery, as well as patient advocates, was really central to the membership of the IOG. And together we've engaged with the vendor system and beyond to provide information on the new service, the legislative changes, the data collection required, and subsequent changes to systems in terms of interoperability. Next slide, please. So I mentioned, I suppose, in terms of that legislative reform, which is required, as we know, to enable the common condition service. And really, in summary, it's just to enable limited pharmacist prescribing. Those 3 regulations have now been signed by the Minister, and the law enables pharmacists to prescribe certain medications for defined conditions in accordance with specific protocols as part of the common condition service. Next slide, please. So media campaign is going to be really key as part of Workstream 6, so communications plan for the public and wider. Today is the first step of that. We have drafted a press release which will issue from the Department of Health in mid-November, and there will be a broader public awareness campaign to go live in early 2026, and we're looking at mid-January for that. So I suppose in terms of that media campaign, it would be just to describe the role of each community pharmacist. There would be consistent messaging. It would be brought from the Government of Ireland, just explaining the new change of law, when to use the pharmacy versus the GP, and managing expectations from the public. Next slide, please. So what will come next for the IOG? So we've got 4 work streams that are still active in terms of publication of the education and training, which Dan Burns will speak to later on, publication of the operational guidelines, guidance and FAQs, and they're very much still in development and will be published based on the feedback that we received today. Workstream 5 is ongoing in terms of enablers for the contraceptive scheme. So we're continuing to develop that service, and it will launch in 2026 when the enablers are in place, including legislation. And it will initially launch with pharmacists entitled to prescribe contraception for short-acting forms of contraception, which have already been prescribed by medical practitioners. We're developing the protocols in respect of that service alongside the Common Conditions Scheme, and there will be a service fee payable by the state for that. Next slide, please. So what will come next for pharmacists? So I suppose it's a busy time of year. We're launching the training and we're really encouraging you to participate in the training if you want to offer the service. There will be a HSE circular that will be published next week, which will give information, further details on an opt-in process for the Common Conditions Scheme. It will also contain information about data collection, and we'll be looking for expressions of interest for 150 pharmacists to provide additional information to really support the development of the service going forward. So, for example, we'll be asking you to provide anonymised data from your records, completing a service feedback survey to capture operational experience of rolling out the service, and possibly participating in small focus groups. So I would urge you to consider becoming a data champion, and as I say, the circular will provide more information on that next week. Next slide, please. So just to say thank you very much for inviting me here today. We have our email address on this slide, which I know the slides will be circulated. So please do reach out with any particular questions. We're really, really happy that we've got this far. The Common Condition Service will be a real safe, evidence-based expansion to improving access to care in the community. We will have the governance processes in place, the training, the communications. So really, we're calling for your engagement here, and your engagement is key. So thanks very much. I'll just hand over to the next speaker.
Thanks very much. Maybe I'll take it from there. So yeah, so good evening. My name's David Hanlon. I'm a GP. I'm the National Clinical Advisor for Primary Care in HSE. Before I go any further, I just want to caution my laptop has been taking to shutting down at inappropriate moments in the last 24 hours since the last Windows update. So if I suddenly freeze and disappear, it's not that I've taken stage fright. Um, but anyway, so Catherine has just given a good bit of detail there around the whole background to it and the governance and the journey so far and how all of this was developed. And as she outlined, it has been a really collaborative exercise with a whole lot of different stakeholders engaged, and it continues to be because it's an ongoing journey. She describes the implementation oversight group that's been established earlier this year, and the role of the clinical subgroup. So the clinical subgroup was a HSE group. We'll get the next slide, please. Which was tasked really to develop the protocols around the common conditions and the extension of the contraception prescribing as so the 8 common conditions, as you know, which were decided from the task force and which we were tasked to provide protocols around are here: conjunctivitis, cold sores, oral thrush, uncomplicated lower urinary tract infections, allergic rhinitis, allergic conjunctivitis, hay fever essentially, impetigo, shingles, and vulvovaginal thrush candidiasis. And as we have all said, the other 2 protocols we looked at related to the short-acting hormonal contraception. We've 2 separate protocols, one for progesterone only and the other for combined hormonal contraception. So get the next slide, please. So this was so I say our task was to finalize, sort of finesse the detail around the conditions for inclusion, to develop the clinical framework for the service and the guidance, and within all of that, I suppose what came out of that one was then kind of what's the formulary, what medicines need to be available or come under the scope of this in order to deliver the common conditions service. There was a kind of a core membership. Most of this, I say, this was set out early in the year, and I rather optimistically think sure it'll only take a few weeks, kind of thing. Sure, it hasn't been all been done before, but let's say it was a little bit more than that, and I'll explain a bit more about the process. The group was chaired by Siobhan Vreen, who's at that time was National Clinical Director for Integrated Care, and I kind of co-chaired that with her, but it was heavily led and informed and all the heavy lifting done largely by pharmacists, with other members. And within given the range of conditions involved, we had to draw on expertise from different things. So for example, the oral candida was very heavily supported by Dr. Bolus and Dr. Hurley, who are actually dentists in the HSE. We'd Basil El-Nazir, Professor Basil El-Nazir from TAL as a pediatrician with respiratory and allergy interest, who gave us a lot of support around the allergic rhinitis, conjunctivitis. We'd huge input from Fiona Lyons, who's the National Lead for Sexual Health in relation to vulvovaginal candidiasis, urinary tract infections, and indeed, of course, the contraception piece. Anne-Marie Tobin, who's a National Clinical Lead for Dermatology, again, and Aoife Doyle particularly put a lot of work into the conjunctivitis and the dermatology related pieces. So we really drew in for each protocol on the expertise and the relevant expertise, but at the core of it, we had a core pharmacy input. So we'd Ciara Kirk, National Lead for Medication Safety, Linda Hisaris from PCRS, Mary Philbin, who's the Chief Pharmacist for Antimicrobial Stewardship in the HSE. Of course, we had Jonathan Morrissey and Anya McCabe, who were very much present and active and very important active contributors to the whole process. And Sarah Clark, another pharmacist from the Medicines Management Programme. So as I say, certainly this was very much designed with pharmacists at the heavily involved at all stages and all levels of this, and actually behind the power behind the throne, people who developed these slides for me, indeed, just are of course anonymous. So that's just to call out 3 more pharmacists: Hazel Slevin, who's the project manager Jack Stapleton, who and Orna Ní Hunallan, who took over from him, who did a lot of the drafting and redrafting and coordination, and who really brought this to the state that it's at. So I really want to give tribute to the all the hard work that was done. And it was a very collaborative exercise and a very actually educational exercise, because you really got a deep dive into some of these things. So I'll go to the next slide, please. So as I outlined, this is, we weren't entirely reinventing the wheel. This has been done before. And I mean, as the task force pointed out, so part of our starting point in this is we looked at what was done in other jurisdictions, what guidance have been developed in other jurisdictions, what inclusion, exclusion criteria, how do they do it? So, and that was, literally from Saskatchewan to New Zealand. So we fairly well spanned the globe, British Columbia, Ontario, Scotland, England and Wales, I think, have slightly different versions as well. So for each of the conditions, we looked at each one individually, and we did it sequentially. We kind of started with these, what we thought were the easier ones, and worked our way through to the ones that we felt were going to be more complex, and really learned as we went along. We, having looked at the different protocols and different forms of documentation that were available across the other jurisdictions, we came a bit closer to home and looked at what we adopted a protocol that is used by HSE nursing primarily. So that's the core structure. So there's a common, when you get to see the protocols, there's a common, consistent kind of look and feel and structure to them all. And I say, was designed by adopting that, we were kind of at least fitting it to an Irish context. But the processes we went through is taking each of the conditions, as we would look at the documentation that had been developed in the other countries, we'd kind of merge them and pick through them and consider what the inclusion criteria were. Did they make sense? Were they relevant? Sometimes odd things turned up and you're kind of going, why did they do that? Sometimes we could see a reason, sometimes we couldn't. So we tried to bring it down to very sensible pieces, and as I say, it was a very comprehensive and thorough going over of each of these kind of common conditions in doing that. And I say, we drew in subgroup expertise, subject matter experts for the different protocols, so that I say, we learned, it was a good CME, it was a good continuing education exercise in its own right, in terms of you'd learn lots of new things. For example, shingles, all the thing about being over for people over 50, the reason for that is no one ever did a study on anyone under 50. So no evidence available for people under 50 apparently, but that's what drove, when you peel back why over 50, well, actually because no one actually asked the question about anyone younger was part of the learning, for example. So the process we had, we developed it, each protocol would have been developed within the group. We would have brought it to the IOG and had a further kind of consultation and feedback, sometimes several rounds of feedback, in terms of trying to get that. And we had it signed off also then within the HSE leadership, and we'd have, I say, the subject matter experts, whether it's antimicrobial stewardship or around ophthalmology, inputting into all of that. So it's been, I say, I think, I hope you find these protocols usable, useful, sensible. I say we took an approach here really to be as enabling as possible, while keeping within, keeping everyone safe, and that's keeping you safe, keeping patients safe, and keeping the population safe, I suppose, in terms of antimicrobial stewardship and elements such as that. So as it was intended to cater to literally the common conditions, the common presentations. Again, noting that if things were getting a bit tricky or going a bit side out of the normal range, the normal range of pathology here, it's I think sufficiently safety netted to keep people safe. And a lot of this will come fairly quickly, come quite naturally to you once you start using these, and some of these things are obviously things you've dealt with historically. Just it's broadening a bit of scope, but equally these protocols will be there. There's other useful detail there and things to refer to if necessary around that. So just next slide, please. So the structure of the protocols, as I was saying, there's a common kind of feel to it, and I suppose I'm not going to go into too much detail around the nitty gritty of it all, but on the left hand side there, you have the scope and background. So what detail about the condition, what we're doing, what the considerations were, clinical features, so describing the actual condition, but also, every red eye isn't conjunctivitis. It's not every, you name it, itch or problem isn't always, every day, it's not always, there's always differential diagnosis, I suppose, is what I'm trying to say. So again, what we're trying to do is say, this is what the typical things look like, and these are the kind of features. But, there's other things that can look a bit like this, but these are the things to watch out for. And these things would suggest it's not conjunctivitis, rather it's episcleritis, or it's allergic, or whatever. So we've had to try and bring that kind of useful or hopefully usable kind of guidance to it. And really it was very much driven in terms of trying to be helpful and provide kind of safe boundaries around things. Again, recognizing that some of these conditions are self-limiting anyway. Sometimes the diagnosis of these things are, not always precise, but what you don't want to do is miss a serious condition, or treat something that when we should be referring it. So that's part of the kind of keeping people safe, keeping the pharmacist safe, keeping the patient safe is part of the thinking behind that. There are, inclusion criteria at the start, so if it's a male with urinary tract infection, just doesn't apply, lads, just stop here. Equally though, as you go through the clinical assessment of the patient, which is, largely based on the history you're going to get, there will be you will unearth a situation where actually, no, I can't prescribe in this context. This person needs to go to the hospital, or needs an urgent GP assessment, or it's just outside of the scope. So while we have got kind of exclusion criteria at the top, they're the kind of the obvious things, like it's a male, or it's a child under 2 or something like that. So they're just, you don't even start. As you work through the assessment, though, sometimes the conclusion of that assessment will be, actually there's something more concerning going on here. This person needs to go see the doctor, or alternatively, actually, no, I'm happy. This is an uncomplicated urinary tract infection. There's no reason why it'd be appropriate to treat it. It is appropriate to treat it this occasion, and we'd go ahead and treating it. So that's, I say, hopefully you'll find the protocols, when you get down to it, really useful and usable. Just go to the next slide there. Nearly done there. So I say, within there's the kind of, at the conclusion of it, there's a few shades of red involved here, in terms of things, the things where this is obviously an emergency. You need to call an ambulance. This is a problem where you don't need to call an ambulance, but they need to go maybe to the emergency department, or they need to urgently see the GP in the next 24 hours, or the out of hours service, or whatever, through to things where you just need to be. So there's a graded set of recommendations around the outputs, just so that there's a bit of proportionality around it, and that was kind of what we're trying to do. So again, that's a fairly common feature across the protocols. Get the next slide, please. So again, the details of the medications we're list out, and we've put in sort of standardized kind of dosing and so on related to that. Again, as pharmacists, you'd be very familiar with dosing and duration, but we would be looking at things like, what's the guidance that we have in antibiotic prescribing.ie, for example, in terms of the dose, the duration, and so on, to make sure these are consistent and aligned. And we've also outlined the kind of the general advice in terms of just the self-care bit, the safety netting, and just obviously the kind of key medication information. Again, as pharmacists dispensing medicines, you're very familiar with advising people about the medicines that they're getting. You'll provide them with all the detail that I should have given them, and so on. So this is very much, it's not intended to cover everything, or to provide a comprehensive list of all the interactions, because that's well within your scope and competence already. So it's not attempting to do any of that. And the next slide, I say nearly done. So again, the journey we anticipate is the patient's going to present to you. You're going to consider, does this come within the scope of is there a common condition protocol for this? Does the person meet the kind of in the entry criteria for, I say, so if it's a female with a urinary tract symptoms, that's yes. If it was a male, you'd be saying nope, doesn't apply. But if they do, then you're just performing an assessment. How sick are they, essentially? What does the diagnosis look like? Am I concerned there's anything more serious going on? And then if and when appropriate, prescribing an appropriate treatment for the person, and that would include actually a prescription, having a document that says we're making that decision, and then offering the providing the self-care and safety netting advice that would be required within that piece. Or indeed you go through the process and you find actually no, there is something more serious going on, and again needing to direct the person towards the emergency department or towards their GP or whatever. And then next slide. So I know we'll skip that on. I think I've given you next slide. So that's just I suppose, really largely an explanation of how we've developed the protocols. I say hopefully you'll find them useful, and really just hopefully provides the kind of assurance that have been robustly developed and that there was a lot of pharmacist involvement within that, so that really they should be hopefully fit for purpose, and will inform both your education and your practice in the future. Thank you.
Super. Thank you very much, Dr. Hanlon. Great to see, as you say, the robustness of the development of the protocols. And now if I could hand over to you, please, Dan.
Thank you, Dawn, and good evening, everybody. I'm delighted to be here this evening to talk to you on behalf of the PSI. And just to say a big thanks to everybody for attending, and also to colleagues in the IIOP for hosting tonight's webinar. Next slide, please. So why is tonight important? Why is this significant? So, Catherine touched on the fact that this has emerged from the work of the expert task force. And in fact, actually, it's culmination of even many years of work and advocacy before that. And the profession and ourselves at the PSI have long advocated that patients should be able to access more treatments and services through pharmacy. This is really a positive step forward for the profession and for the health system. And it is, a positive step towards addressing system and patient need. It is also a reflection of the confidence and trust that's placed and held among the profession by patients and the health system. And I hope you've seen from this evening so far, and I hope it's giving you confidence that there has been a whole of system approach to the development and implementation of this service. It's also, I suppose, important to take solace from the fact that this is building on international experience, and it's been shown that this type of service can be delivered safely and effectively by pharmacists in other jurisdictions. And also, I suppose, important to think about that this is a stepwise approach, as Catherine mentioned, to full autonomous and independent prescribing for pharmacists. So, a very significant time for pharmacy and a very positive time for pharmacy, I would say. Next slide, please. So, as has been touched on already this evening, there are a number of key enablers for the Common Condition Service, and they all form essentially the regulatory framework that's going to underpin the delivery of safe, high-quality services across pharmacies. So the legislation amendments, which Catherine mentioned, the HSE protocols that Dr. Hanlon mentioned, the IIOP delivered pharmacist training, which I'll touch on and will be expanded on by Ailbhe, and then the guidelines that we have developed within the PSI to support pharmacies and pharmacists in delivery of the service. Next slide, please. So talking about the PSI's role in supporting development of the service. So as Catherine mentioned, there was 4 colleagues within the PSI who are members of the implementation oversight group. And we were tasked in particular with two of the key work streams, which is in relation to training, and then also regulatory supports. So the guidelines that are due to be published shortly. And then also we see a very important role for us in terms of our communication channels with the profession and also with patients and the public. Next slide, please. And so touching on the pharmacist training, and as part of our work on the implementation oversight group and then our engagement with colleagues in the IIOP, we wanted to make sure that the pharmacist training was proportionate and recognized the experience and the knowledge that pharmacists already possess, and in acknowledgement of that many of these conditions are conditions that pharmacists are seeing in their day-to-day practice, and so that the training should be pitched at the appropriate level. It was important as well that the training would be mandatory, and that's just, I suppose, to ensure there was confidence in the system among patients, among the health system, and also among the profession, that there was a consistent level of service delivery and a consistent level of knowledge for all those delivering the service. Ailbhe will touch on it in a bit more detail, but just to say there is just one training package, although it's split up into different modules. So there's training via a core regulatory module, and then there's 8 condition-specific modules. And it is intended that all training would be completed. It's not a kind of a pick and choose. Once you're planning to deliver the service, it's required that you would complete the training on all aspects of it. As Catherine mentioned, the training is underpinned by statutory rules, and it has been developed by a development team within RCSI, and will be published via the IIOP. Next slide, please. So then looking at the guidelines, I suppose the guidelines have gone through an iterative development process, and as is standard for us when we're developing guidelines, we would have consulted via a public consultation over the summer on the guidelines, and we're very grateful to all those who contributed. And you'll see there was a number of different channels that we reached out to, including getting direct input from patients and the public, and also through direct engagement with registrants or pharmacists, and our other key stakeholders. Next slide, please. And what that has meant is we've developed guidelines that we are very happy with in terms of that they're going to be, we think, a very supportive aid to pharmacists in helping to deliver safe, effective, patient-centered services, while also ensuring legislative compliance. They're pitched at a principle designed to promote consistency and safety, while also enabling pharmacists to apply their professional judgment. And these are intended to be complementary to other supports, not intended to be operational. There will be separate operational guidance that will sit alongside these. Next slide, please. And so the guidelines, as I said, are principle-based, and there's 7 principles that you will see within them. So the first is person-centered care and clinical responsibility. The next is in relation to the governance aspects, maintaining quality and achieving regulatory compliance. The third is in relation to achieving and maintaining competence through training and CPD. The next, principle 4, is structured patient assessment, communication, and informed clinical judgment. Principle 5 is safe prescribing and use of protocols, and particular emphasis within this on the importance of considering antimicrobial stewardship, considering the nature of the conditions and the nature of the approved or authorized treatments. Collaboration and continuity of care is principle 7, and then documentation and record keeping finally is principle 6, and principle 7 is documentation and record keeping. Next slide, please. And then just in relation to our commitment to, I suppose, keeping pharmacists informed, we've sent a number of communications already, and we will continue to keep pharmacists informed via email and through our website as we move to service implementation. And as Catherine mentioned, there's an initial bank of FAQs in development through the IOG to address questions that have arisen to date. There were many questions that we would have received as part of the public consultation process and through other sources. And tonight's webinar is another important source of questions that will help, I suppose, address those common themes that are emerging from the profession that we can try and address. And also ongoing delivery and monitoring of the service will also generate additional questions, and we commit to make sure that they continue to be answered and published in due course. Next slide, please. And so, as I mentioned, that the operational guidance will come separately, but I suppose from an implementation point of view, from a regulatory standpoint, we do have some recommended approaches and suggestions for pharmacists and also for those particularly in governance roles. So I suppose step one is kind of, I suppose, that reviewing step, so carefully reviewing and familiarizing yourself with the enablers that we've mentioned tonight. The guidelines should be read and understood alongside the additional supports, including the training, the clinical protocols, and the operational guidance. Next is to discuss. So those in governance roles should engage in team discussions to collaboratively develop and implement procedures that ensure compliance with the guidelines, protocols, and the legislative framework. And then moving to implementation. So that's really about implementation plans to make sure the necessary changes can be adopted within the pharmacy practice and done so safely and in a planned way. Next slide, please. And so I suppose what next? And Catherine would have talked about some of these next steps as well. And I suppose, there is time now, which is good. And I think it was a real objective of the IOG was that the profession would have time to sit with these messages, with the enablers, and to plan for safe implementation of the service. So I suppose step one is really around where we're at now, which is the preparation. And that's about as much preparing yourself from a mindset point of view and your team, and familiarizing yourselves with the structure and content of the clinical protocols, the training, and the guidelines, and understanding which medicines are authorized to be provided through the service, where they are prescription-only medicines. From a governance perspective, that's then moving to things like developing pharmacy-specific policies and thinking about things like incident management in the context of the service and commitment to open disclosure. Then the training is going to be obviously a key component, and that's both your own training as pharmacists, but also your pharmacy team's training, and thinking about how other members of the pharmacy team can support the service delivery, particularly any tasks or aspects of the service that don't require pharmacist input. And then also to reflect on any additional training needs as would be signposted in the IIOP training, including any training on things like antimicrobial stewardship that you may need. And then moving on to operating the service. So that's about reviewing the operational guidance once it's published, preparing your pharmacy. So that's things like how you're going to highlight the service availability to the public, setting up your consultation room, thinking about the patient journey in your own pharmacy setting, and then doing things like practice runs before you launch the service officially to see, have you thought about all of the end-to-end aspects that need to be considered. It's also really important that you think about the resource and staffing considerations and how you're going to incorporate this into your existing pharmacy workflow, and considering whether you're going to be offering this as a walk-in versus an appointment-only service. And I think another important aspect of this service and something that pharmacists need to consider from the outset is thinking of the various outcomes, including instances where patients may be disappointed with what's being recommended, because maybe they were expecting a particular treatment, but understanding that you need to apply your professional judgment and explain why what you're recommending is the correct course of action in your view. And then finally, being part of the review and ongoing monitoring of the service. So Catherine mentioned the opportunity to become a data champion. There's also a really important aspect of just reviewing and auditing the service within your own practice to support continuous quality improvement and assessment of the service success, and then contributing at that national level where the opportunity presents itself. So just the next slide, please, is my final slide. And it's just to say, I suppose, you've received a lot of information this evening. And while it is an exciting and significant time for pharmacy in Ireland, it can also potentially feel a bit daunting. So just, break it down into manageable steps. And the next steps are, once you have access, which is coming next week, to the training, to the protocols and the PSI guidelines, it'll start to become clear what this means for you and your teams. And I'm sure many of the questions that you may be sitting with currently will be answered. There are actions that need to be taken, but the positive thing is that there is time to digest and plan, and there's no immediate rush. So just take solace in that, and take the next steps as they become available to you in terms of those supporting enablers. Thanks, everybody, and happy to be part of the Q&A shortly.
Thank you very much, Dan, for that really in-depth journey through the legislative and regulatory changes. And Ailbhe, if I hand over to you next, please.
Thanks, Dawn, and thanks everyone who's gone before me. I'm conscious that there is a whole lot of information. So Audrey, we'll move to the next slide here. I'm just going to take you through really briefly the Common Conditions e-learning program, kind of why we're here, why the training was needed, how it was developed, what it involved, and then how you can access it and do it. And towards the end of the presentation, I'm going to show you some screenshots from the program, just kind of so it'll be familiar to you when you do have access to it in the coming week. So, the training was developed with a multidisciplinary team. Audrey, on the next slide, there's a little bit about the background, if you wouldn't mind clicking. Thank you. So the purpose of the training, it was requested, as mentioned by my colleagues on the call, by the Implementation Oversight Group. And the reason behind it is to ensure a standardized approach to the delivery of the Common Condition service. It's a mandatory training program for any pharmacist that wishes to deliver the service. It's been developed to align with the legislation and the protocols. But I suppose most importantly for us to say to you, it's been designed to give you confidence in delivering the service and consistency in patient care. So completing the training ensures you do meet your regulatory requirements, and the program is designed to support you prescribing under protocols. The program is a result of a collaboration between pharmacists, GPs, clinical advisors, e-learning designers, and regulatory experts. We're very fortunate to be able to deliver and develop this project with a team from RCSI and a multidisciplinary team that brought a vast amount of expertise and practical experience. So the result is that there's the evidence-based program that's clinically sound, practical, and we hope you'll find it very engaging. So to say completion of the training, it's not just about a compliance exercise. It is also a key part in supporting you in safe, effective practice. So on the next slide, we'll have a look at the program overview and the structure. So you've all heard this evening that there will be 8 conditions. So the program structure consists actually of 9 modules. There's one core module which will take you through it's the key to the training really. It provides key context needed before completing condition-specific modules. The topics that are included in the core module include your essential legal and ethical considerations, prescribing competence. It has an introduction to the protocols, some guidance around documentation, communication skills, antimicrobial stewardship, key things that will help support and provide the service. The next part of the program then are the condition-specific modules, and there are 8 of those, 1 for each condition. Now they'll follow, just in terms of familiarity and making it easier for you as the learner, they each follow a 4-step structure, and they follow the same structure. So patient assessment, checking your protocols, what are your treatment options, and then any special considerations related to that particular condition. Each module, they're interactive. We have videos, case studies, and kind of practical application along the way where you can use the protocols and consolidate your learning. At the end of the course, you will have to complete assessments in order to receive your certificates, and these certificates, as Dan alluded to, are required before you complete the service. So I'll just, on the next slide, talk a little bit about how you can complete the training. It's hosted on the IIOP website. When it becomes available next week, you'll be able to book your place once you're logged into your account through the courses and events page, as you would book onto any other of our training programs. It's a self-paced program with progress tracking so that you can dip in and out when you have time to complete the conditions and the core module. There's downloadable resources as part of the program, and also to say that technical support is available from the help desk. We'd be delighted to hear from anybody that has program issues to get in touch by email. So just on the next slide, I'm going to whiz through the navigation, or just to give you a brief overview of what to expect and how it will appear. So there are 2 courses, and you will need to enroll yourself on both courses. One is for the core module, one is for the conditions. And the reason it was built in this modular way is to allow for the addition of other conditions in the future, or indeed the continuation of contraceptive modules. It gives an agility to the service so we can provide training as needed to pharmacists. So the core module is on its own, and this should be completed first because it gives you the context and the background needed to complete the condition. On my next slide, you can see the landing page of the core regulatory module. So there are several core pillars which have been identified by the development team. They're divided into chapters across the way. So legal and ethical framework, documentation, prescribing competence, and a few other pieces there. Throughout the course, you will see little blue icons. Actually, this is probably familiar to people who've been in and out of our resource hub over the past few years. So these little blue icons are click events. The next slide just shows what would happen if you click one. And that basically, it provides you with a little bit more information. There's several of these throughout the program. Some are information points, some are useful links, some are videos. And again, I'm just on the next slide, I'll take you through how you will get between. Again, very similar to how you would navigate between our resource hubs. There are slides and you use the arrows on either side and you use the condition specific. You can use the tab at the side as well as an index of where you are in the training. There are several chapters and you can use the big arrows at the top and bottom of the screen to move between the chapters or the side menu. If we just skip forward 2 slides, Audrey, I'm conscious of the time. After that, there is a core module assessment. And once you complete that assessment and achieve your score, you will get the first certificate that is required. So thereafter, the next slide then is just a sneak peek at the condition-specific module. You'll see there is an icon for each of the conditions, and behind that is its own training module each, and you can complete these in any order that you would like, and you can dip in and out along the way. Once you have completed them, again, there is a multiple choice question assessment at the end of each condition. So the next slide just talks briefly about the structure that we're following. We mentioned using this 4-step structure that you would then could apply an approach to each condition. So patient assessment, in this we cover the clinical assessment and diagnosis, where you will be gathering information from your patient, recognizing those symptoms, and Dr. Hanlon touched on the differential diagnosis piece as well. So we really hope that this chapter will be key in supporting you and gaining confidence recognizing these conditions. So, getting you confident with using the protocols and being familiar with navigating and dipping in and out. So the aim of this is to support you using the protocols and applying them, and focus on then, once you've used the protocol, to identify the next steps, working on your treatment options. And again, that final chapter for any special considerations that there might be related to the condition. Now, next slide, please, Audrey. We have knowledge checks throughout the chapters, and it's just to check your understanding. It's an opportunity to apply the protocols to the scenarios. On the next slide, there is just an example. You can click a case. If you click to the next slide, please, Audrey, you can click a case and use then the protocol to determine the right answer, either what is the most likely diagnosis, treatment options. It's what we hope will be a practical application for you going forward. After that, then on the next slide, you'll see that it's, again, just to show you that there is a condition, and then there's an assessment to be completed after that condition. The final slide then, is before I wrap up, is just to show that there is a certificate for this part as well, which is also important for completing. It's required for completing the service. So what are the next steps for you as the learner? Thank you, Audrey. On my last slide, the e-learning program will be available through the IIOP next week. We're going to share details via email and our social media, so just keep an eye on those so that you'll be informed when it is available. Completion is mandatory before delivering the common condition service. But as Dan mentioned, we're delighted to be able to provide the training well in advance of the service so that you can start early. You have time to become familiar with the content and chip off little bits of those conditions and the core module as you go. We feel it's important to say that the IIOP, we're here for you. There will be ongoing support. Delighted as a profession, we have adapted before. I'm a community pharmacist by background. I have to say I was really excited to see this training coming, to see where it's going, thinking we've come through vaccination training and emergency medicines, the COVID journey, and now working with the IIOP to see where we've been able to support pharmacists along the way. So this is just another step forward. Yes, the programme does meet your regulatory requirements, but it's the start of a new journey for us. Updates will be provided to the training and the website as guidance evolves. And we'll continue to support you through our webinars and other flexible learning modes. We will be collaborating with the IPU later in the year to deliver a webinar to support delivery and practice. And we're also planning on holding webinars on clinical topics relevant to the service. Just you can see on the screen there, the Resource Hub is a real valuable repository of information, and we'll continue to deliver our usual supports as well, webinars, mentoring, workshops. And just to say an important, I've highlighted on the screen there, if you just want to make sure that you're subscribed and signed up to our newsletter, that's one place where you will get lots of updates as well. And finally, I just want to ask for participant feedback when the time comes. It's very important to informing the work that the Institute does and in knowing what training supports we can provide for pharmacists. So when the time comes, we'd be delighted to hear from you in terms of what supports you would need. And it's crucial to further support the profession to make the service roll out a success and a good experience for all. So thank you. I'm sure you're eager to get onto some questions.
Super. Thank you very much, Ailbhe, for giving a really clear rundown through the training requirements, and great to see some of those slides and what they look like in practice. I think just before we get into the questions, two really strong messages that I'm getting from tonight is just the robustness of the evidence base, as you alluded to, Dan, to support the trust that patients put in pharmacists in not only the rollout of this service, but in treatment and looking after their care needs overall. So I think that's wonderful to see that. And also to see the degree of interprofessional collaboration. I think it's just a wonderful example to see that in practice. And it's a credit to the development of the process in terms of our development of the protocol process that you've alluded to, Dr. Hanlon, in great depth as well, to just really lean into that, degree of interprofessional collaboration throughout to see that what is the output in terms of the protocol has been so well considered over such a period of time. And as you've alluded to as well, Dan, and Ailbhe and Catherine as well later on, in terms of the positive enablers and the supports there for pharmacists at this time of both change and excitement in terms of a new service, but what that brings with in terms of the practical realities as well for the profession. So just to go to the Q&A box, please do continue to add your questions to the box. There are a number of questions coming in around the implementation aspect. So in terms of record keeping requirements, in terms of specifics around, dispensing quantities, etc. And I'm conscious that the panelists tonight have addressed that, Catherine, initially in terms of the implementation guidance that's coming, Dan, in terms of the guidelines that are being produced from the PSI and the FAQ documents, and similarly, Ailbhe, as you've alluded to, with the training requirements. But maybe, Catherine, if I could direct that question at you, just in terms of next steps and what pharmacists can expect in an overall capacity in terms of implementation, that would be great, please.
No problem. So yes, thanks for the questions, everybody. We can see them coming in. In terms of the next key steps for pharmacists, a circular will issue next week, indicating timelines for commencement of the service. So pharmacists who are participating will be asked to indicate to the HSE whether they will be able to participate from the 19th of January, the 23rd of February, or the 31st of March. The operational guidelines will be published again on foot of a lot of the conversations today. We'll be updating them. Again, we alluded to the fact that the training will issue as well next week. The public campaign will officially launch on the 19th of March, but we will issue a press release in November just signalling that the service will be launching and encouraging pharmacists to participate in the training and to sign up with the HSE. I saw a question coming in around the 150 data champion pharmacists. So there will be an annual allowance of €1,667, which will be paid to those pharmacists. And there's more details on the actual data collection piece in the circular to issue.
Super. Thank you very much, Catherine, for addressing that. And you've actually preempted a second question with the timelines. There's a lot of questions coming in on the implementation timeline. So that is great. Thank you. Another question just around the data champion and how that will work in practice. Do you have a sense of that and how information will feed back from the data champions into the scheme more generally or into the Common Condition Service itself?
Just to clarify one point there, I think I may have said that the media campaign was launching on the 19th of March. It's launching on the 19th of January, just to clarify that.
Thank you.
So in terms of the data champion piece, yeah, it's very much around evaluation of the service and looking forward to the future to see what's working well, what's not working well, what was needed in terms of changes to pharmacy practice, what were the main conditions that people were coming to pharmacists to be assessed for and diagnosed and treated. And then I suppose in terms of the roadmap towards more autonomous independent prescribing, we need this data to really support the evidence base for it. So really trying to encourage people, if they're interested, to sign up for it. We will be looking at 6 monthly returns, with the first return of data to be in July.
Super. So really important for the profession to keep feeding into what is a continuum and an evolving service for patients. Super. Thank you for addressing that. Ailbhe, there's a number of questions coming in on the training and a few questions around the need to repeat the training. Or is that something that's up to people's clinical judgment in terms of professional competence and refreshing their knowledge? Could I direct that question to you, please?
Yeah, thanks, Dawn. So it is a once-off training program. You complete both your certificates, and thereafter then it's maintaining competence with the service. So there are 9 modules. The core module will take approximately 1 hour to complete, and then there are the condition-specific modules, of which there are 8 for the moment, with an assessment thereafter. And pharmacists will be expected to remain up to date with current clinical practice and the clinical protocols, and utilise those in their day-to-day deployment of the service as well.
Brilliant. Thank you very much. And I know there'll be a lot more information on the IIOP website and within the common conditions themselves in terms of trying to inform people of the required knowledge to deliver the service. So I know the supports are there, as well as the supports that you have mentioned, Dan and Catherine and David, with the protocols as well, which is fantastic. And a few questions are coming in around locum pharmacists, and will locums be able to prescribe under the service as well? And maybe if I could address that to you, Ailbhe, or to Dan.
I'm happy to take that,
yep.
Dawn.
Thank you, Dan. Yeah, thank you.
So yes, absolutely. Any registered pharmacist who has completed the training is authorised to complete. However, you would need to make sure that the pharmacy, obviously, you're working in or locuming in, is set up to deliver the service, and that they have the requisite policies and procedures in place, and also that they're happy for a locum pharmacist to deliver the service within their pharmacy. But the service is set up in such a way that any pharmacist within a pharmacy where the service is being delivered can provide it.
Brilliant. Thank you very much, Dan. And if I could, before I let you go, could I ask you to take another question, if you wouldn't mind, please, on the medicines that can be prescribed within the service? So we're getting questions in about EMPs and how a pharmacist know what medications can be prescribed, etc. If you wouldn't mind taking that question as well, please.
Yeah, of course. So I suppose there's 2 places where you'll be able to find the list of medicines. One is in the actual legislation. So there's been a new schedule created, a 13th schedule to the medicinal products regulations. And that's where the specific products per condition are listed. And also then, of course, they're included in the clinical protocols themselves. And, based on the diagnosis that's come to the particular product or range of products, as the case may be, are listed in the protocols as well, just to guide pharmacists when they're providing the service. And there was a question there around, will there be, the ability to provide substitution medicines or EMPs? And if there are certain EMPs that are listed already, but if they're not listed in the schedule, they won't be able to be provided. So that's not within scope for the service.
There's brilliant. So the protocols are driving the prescribing by pharmacists. Yeah. Super. Thank you.
And that's scheduled in the legislation as well.
Fantastic. Thank you. So that's great to address it across the legislation and the training. Fantastic. I'm conscious there's a lot of questions coming in. I'm mindful of people's time as well, after a long day at work for most people on the call. So there are a number of implementation related questions, and indeed we've got a lot of questions prior to tonight's webinar on all sorts of aspects. Some great questions. So just to reassure people that those questions will be recorded, collated, and provided to the Department of Health in terms of informing the next steps. As I said at the outset, it is very much a first part of a multi-part approach to informing the profession about the service and how it will be implemented in practice, and all the aspects in terms of training, legislation, regulation, and the clinical protocol. So I just want to reiterate what Ailbhe has touched upon in terms of IIOP will be running further webinars in conjunction, the next one with the IPU in terms of implementation, and there are a cohort of resources that are available that Catherine has spoken about, that David has spoken about, Dan has spoken about, and Ailbhe has spoken about across all the different facets of the implementation. So I think great supports and positive enablers as people plan their move to the implementation of the service in practice. So with that in mind, I would just like to thank everybody for attending tonight. What I think you'll agree has been a fantastic webinar, very, very insightful. And it would be remiss of me to not invite people to complete a CPD cycle as part of their learning this evening. I think an awful lot of food for thought. The post-webinar survey will be issued through email, through the usual route. And again, we'd really appreciate any feedback or comments that you have that we can feed into the next phase of collated information from the profession that can go to the department to further inform the guidance document. So I suppose it's really important that we continue to do that as pharmacists. And as Catherine has alluded to at the start, there is an email address that people can continue to ask their questions through and post comment on as well. So thank you all, our panelists. I'd like to thank Catherine, Dr. Hanlon, Dan, and Ailbhe this evening. I'd like to thank all the attendees for taking the time to come to this very important webinar. I hope you found it useful and of value, and just really, I think a positive takeaway for me is just the amount of resources and supports that are there for the profession as the Common Condition Service is prepared to be rolled out. So thank you all very much for attending, and I'll say good night and bring the webinar to a close. Thank you.